Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. Last segment, we talked to Dr. Patricia McManus, who is the health commissioner for the city of Milwaukee, about a recent spike in numbers dealing with HIV and syphilis. Late last year, the Milwaukee Health Department identified 76 connected people who tested positive for HIV, syphilis, or both. We're now being joined by the president and CEO of the AIDS Resource Center of Wisconsin, Mr. Mike Gifford. How are you, Mike?
Good morning. I'm doing well. Thank you for having me.
Thank you for being here. And you were one of the health leaders who was in attendance at this press conference that took place dealing with the spike in numbers that we've seen recently. Tell me your thoughts surrounding this very serious issue.
Well, first of all, the press conference that you referenced was really good news for the city of Milwaukee because you saw the coming together of public and private resources and leaders to address a very serious issue. You know, this social network needs to be a clarion call for all of us to do more in the fight against STIs and HIV. What we've done so far simply is not producing the results that we need to produce for our kids.
All right, so we look at the 4,400 cases of gonorrhea in Milwaukee, putting us with the highest rank in the nation. And is it accurate to say that when someone is exposed to sexually transmitted infections, they are more vulnerable to contracting HIV?
Well, certainly what it indicates is that their behaviors lead them to be at greater risk for HIV, right? We have to remember HIV and STIs spread in the same way, and what we're seeing is this large increase in STIs here in the city of Milwaukee, but we have to remember that it's within the context of a national increase in STIs. So, as an example, in the last 5 years, the number of syphilis tests or syphilis cases around the country has nearly doubled. And we know that the social network here in Milwaukee, as we've been reporting on it here, there's been another one that's been identified in Pennsylvania, another one down in Arizona. So this is a serious issue that's not contained to Milwaukee, but as leaders here in Milwaukee, we need to do better to respond to it.
Yes, you have said in a quote that clearly the response has not been quite enough in your opinion, so I'd like to know, what would you like to see done to really see a change in these numbers?
Sure. There are some really important and relatively easy things to do. I mean, certainly greater education, and I was excited to see that Milwaukee Public Schools began an enhanced education effort upon finding out about the social network, and I know that they're planning to do more, and they're really looking to partner with the community and the health department to do that. So that's a really good sign. We have to provide better access to condoms. We know that condoms is one way, not the only way, but an important way to stop HIV, to stop STIs, and to stop unwanted pregnancies. And we need to, as a community, come together around condom access for sexually active young people. And then we've got to provide greater access to HIV and STI testing. The health department does that in their 3 locations. I'm glad that ARCW has expanded to a number of new locations in the city of Milwaukee to do that also.
Yeah, and there are a number of things that you said, so I want to go back. You had said, you know, the number of young people who are sexually active, but I've even heard some young people who probably are not knowledgeable about how behaviors can lead to different things. They don't always see certain acts as being sex, so to speak.
Yeah, and, you know, and the challenge when it comes to HIV is that oftentimes we think about HIV from the context of the history textbook rather than the health textbook, and from the context of something that has happened versus something that is happening. And we need to realize, and this social network is a great example of it, unfortunate, but a great example to re-energize our efforts to educate our young people about HIV, about STIs, the behaviors that put them at risk, the different types of sex, and how they can protect themselves.
Yeah, so the AIDS Resource Center of Wisconsin, you guys are nationally recognized for the outstanding work that you do. So I think it's important to talk about some of the preventative services that you offer to individuals on a daily basis. One thing that I read about on your website, and I'm thinking I did not even know this existed, but there is a pill that's called the PrEP pill that really can help individuals steer clear of HIV infection?
Sure. So PrEP is an acronym for pre-exposure prophylaxis. It's essentially taking one of the common medications that we give to people who are HIV positive and give that medication to people who are HIV negative. That, along with using condoms, and it's important it's a both and, the medications and the condoms can be 99% effective in preventing somebody from contracting HIV in the first place. It is the most significant breakthrough that we've had in the fight against AIDS in decades. decades.
Wow.
We need more people to understand the availability of it, and that along with condoms being a way to protect themselves from HIV and STIs.
And you guys have medical clinics not only here in Milwaukee, but in other places across the state as well.
Right, and we welcome people to come to ARCW, arcw.org, or the hotline that we've set up in the community, 414-223-6801, to get all their questions answered and get access to the medication we were just talking about, PrEP, to help protect themselves from HIV.
And so if someone is interested in have some type of testing done, they are able to just walk into the center and ask for those services?
They can walk in, they don't have to give their name, they don't have to pay a dime, and the service will be provided. We've opened up into the evenings to help respond to the social network reports, and we'll provide easy access to that testing.
Yeah, and I'm always really just in awe of all of the services that you're able to offer to individuals where they don't necessarily have to go to an appointment here, there, and all over town. You really are one-stop shop in helping make a difference in the lives of the people that you serve. You have a food pantry, a dental clinic, and the list goes on, right?
Yeah, so the ARCW is really nationally renowned for the medical home, the one-stop shop that you reference. And it's integrated health and social services, medical, dental, mental health, drug treatment, which is important given the opioid epidemic that we're struggling with as a society, but then also food pantry, case management, housing assistance, and legal services. And all that coming together is a great way to support people with HIV to live a long and healthy life.
And you guys have an AIDS hotline. And you can give us that number and kind of explain, if someone dials the hotline, what are some of the things that they can utilize that for?
Sure. So the number for the hotline, 414-223-6801. And that is for any question that people may have. If you are a young member of our community who may be at risk because of the social network, if you are a parent of a teen who needs help learning how to and finding the words to talk to your child about HIV and STIs, you can get that help there. We provide access to information about access to testing at ARCW and among community partners. Certainly if you're HIV positive and need care and treatment, you can get your questions answered there also.
Okay, so as we wrap up, I'm interested in knowing what would you like to put in place through the AIDS Resource Center of Wisconsin in helping spread awareness and really working with these other organizations like the health department and other organizations who really do the same things as far as giving testing and things of that nature?
Sure, there's a role for all of us to play in this, and I was excited to see that more than a dozen organizations at the press conference. ARCW is pleased that we put together a strategic leadership fund of $250,000 that other organizations and entities can seek funding to support enhanced programs. We're excited about extending our own HIV testing to 5 new locations in the community, and look forward to working with those partners to find new and better ways to address the epidemic of HIV and STIs in our community.
Well, I thank you so much for coming by and giving us this great information, and I'm hoping that someone watching today can take this information and not only spread the word, but just feel like they walked away knowing more than they did when this segment began.
Thank you very much.
Thank you. Mike Gifford is the president and CEO of the AIDS Resource Center of Wisconsin, which, like I said, is nationally recognized for the outstanding work that they do. For more information on anything that we've discussed, you can visit their website at arcw.org, or you can call the hotline at 414-223-6801. We're going to take another quick break and come back to look at an issue that caused Oprah Winfrey to travel here to Milwaukee to do a special report for 60 Minutes. We'll discuss trauma-informed care with psychologist Dr. Robert Fox right after this.